Welcome to What I'm Reading, What I'm Thinking, a behind-the-scenes look at the research shaping my upcoming book on structure, function, and breath. Grounded in clinical experience, this series explores how fascia, movement, and internal pressure systems work together to influence the body's alignment, function, and overall structural health. Let's dive in. I just read a fascinating clinical suggestion from the North American Journal of Sports Physical Therapy that breaks down a deceptively simple but powerful breathing and postural exercise. The 90-90 bridge with ball and balloon. Here's the big idea. Breathing and posture aren't separate systems. They're integrated. Many muscles used for both postural control and respiration are the same, such as the diaphragm, transverse abdominis, and pelvic floor. So when your breathing is off, your posture is often off, and vice versa. This can be associated with musculoskeletal complaints like low back pain and sacroiliac pain. It's important to remember that while we're focusing on one common contributor here, low back pain can stem from various underlying patterns. And this particular approach with the balloon is most relevant with these specific respiratory and postural mechanics that are involved. The authors emphasize one concept I talk about a lot in my own work, the Zone of Apposition, or ZOA. This is the area of the diaphragm that corresponds to the cylindrical portion directly opposed to the inner aspect of the lower rib cage. When the ZOA is optimal, the diaphragm has maximal efficiency for both respiratory and postural roles. But with suboptimal posture, think increased lumbar lordosis, rib elevation, and interior pelvic tilt, that dome flattens, decreasing the ZOA. This can lead to inefficient respiration, diminished activation of core muscles like the transverse abdominis, and compensatory breathing strategies like increased use of accessory muscles of respiration. Over time, this pattern can contribute to low back pain, sacroiliac pain, and other issues. Poor posture can also involve muscles like the psoas, which can pull on the lumbar spine and increase lordosis. Remember from our last episode how the psoas isn't just a mover, but a crucial pressure regulator, deeply connected to the diaphragm. When breathing mechanics and ZOA are off, the psoas can become part of that dysfunctional pattern, often reflecting and contributing to the very core pressure imbalances that lead to pain. So how do we fix it? That's where the 90-90 bridge with ball and balloon comes in. It's a structured breath and positioning drill developed by the Postural Restoration Institute. This exercise is designed to optimize breathing and enhance both posture and stability in order to improve function and/or decrease pain. The exercise helps restore the ZOA and spine to a proper position, allowing the diaphragm to optimally perform both its respiratory and postural roles. Here's how it works. You lie on your back with your feet flat on a wall, knees and hips bent at a 90-degree angle, a 4-inch ball between your knees, or you could use a yoga block, and a balloon in one hand. You inhale through your nose with your tongue on the roof of your mouth, and as you exhale into the balloon through your mouth, you perform a pelvic tilt so your tailbone is raised slightly off the mat, keeping your low back flat. Do not press your feet into the wall, instead pull down with your heels. You should feel the back of your thighs, the hamstrings, and inner thighs, the adductors, engage, maintaining pressure on the ball. This position encourages lumbar spine flexion, posterior pelvic tilt, and a rib internal rotation, which helps optimize the ZOA and inhibits overactive lumbar extensors. The resistance of the balloon during exhalation requires increased abdominal musculature activation, helping the abdominals oppose the diaphragm and maintain an ideal ZOA. This also helps pull the lower ribs down and in. You'll then pause for 3 seconds with your tongue positioned on the roof of your mouth to prevent airflow out of the balloon. Without pinching the neck of the balloon, inhale again through your nose and repeat. The hamstrings and the gluteus maximus activate for hip extension, moving the pelvis into a posterior tilt, while the abdominals pull the ribs into relative depression and internal rotation. This pelvic and rib position helps to optimize abdominal length ZOA, which increases. The back pressure from the balloon during inhalation with the ribs held down directs air into the lungs to expand the apical area. This apical chest wall expansion can be particularly beneficial for individuals with scoliosis, depressed shoulder girdles, or rounded shoulders. This isn't just about activating individual muscles, it's about restoring the coordinated dance, the co-activation between your deep abdominals, diaphragm, and pelvic floor. That's where true stability and efficiency come from. The research shows promising outcomes for this balloon exercise across a wide range of patients, from kids to seniors, for conditions like low back pain, SI joint pain, asthma, and thoracic outlet syndrome. Consistently, they experienced improved function and decreased pain. For example, published cases highlight a woman with chronic sciatica recovering 100% function and becoming pain-free, and a football player with thoracic outlet syndrome avoiding surgery to play again. Asthma patients have also seen notable improvements in lung capacity. That's a big deal and worth experimenting with. This bridges directly into the themes of my upcoming book about structure, function, and breath. When I talk about hydrostatic pressure, I'm thinking about the internal balance of fluids and forces within our body. Just like a well-inflated tire holds its shape and provides stability, optimal intra-abdominal pressure, supported by a properly functioning diaphragm and core, creates a stable, resilient core that supports the spine. And as we explored with the psoas in the last episode, this muscle is a key modulator of this internal pressure environment. By improving diaphragmatic function and ZOA through the balloon exercise, we're not just influencing the diaphragm, we're creating the conditions for the psoas to better perform its role in this pressure system, fostering that fluid, adaptable coordination we talked about, instead of it being a tense responder to a poorly managed core. How does this relate to fascia? Think of fascia as a continuous interconnected web throughout your body. When the diaphragm isn't working efficiently and we lose that optimal ZOA, it creates tension patterns and restrictions in the fascial system, often radiating into the neck, shoulders, and even down to the hips or ankles. By restoring the diaphragm's function and internal pressure, we're essentially rehydrating and optimizing the fascial connections, allowing for greater freedom and fluidity of movement. This reinforces my belief that most people aren't lacking strength, they're missing pressure. We often default to strengthening exercises, but if the foundational pressure system isn't optimized, we're building strength on a faulty base. It's like trying to fill a leaky bucket. The 90-90 balloon drill helps plug the leak, allowing subsequent strength work to be more effective and integrated. And I've seen this firsthand in my own practice when I encounter this specific pattern of core instability linked to inefficient breathing mechanics. Incorporating this type of exercise has often yielded really positive results. Now, while this exercise is powerful, it's always best to consult with a healthcare professional, especially if you have pre-existing conditions. They can help diagnose the underlying cause of any pain and determine if this specific approach targeting respiratory and postural patterns is right for you. And it's not a universal fix for all types of low back pain, but can be very effective for this particular presentation we've discussed. Once you start to feel this integrated core activation, you can begin to carry it into your daily activities. Think about maintaining that sense of internal support when you're walking, lifting, or even sitting at your desk. It's not just an exercise, it's a new way of engaging with your body. That's it for today's dive into the research. Have you ever tried breathing exercises for pain relief? Or noticed how your breathing changes when you're stressed or in pain? Share your experience in the comments below. If you found this episode valuable, please share it with a friend or a family member who might benefit. Spreading awareness about these fundamental connections can truly make a difference. Make sure to subscribe and stay tuned for the next one. There's a lot more coming.